Good afternoon, and welcome to our first ever Lakeview Regional Medical Center house calls interview with one of our physicians. So we are here with Dr. Lance Worley. Hello, Dr. Worley.
Hey, how's it going?
It's going well. Thank you for taking the time to join us today. This
Absolutely.
is something new that we are doing to provide access to our physicians for patients in the community and people who are just curious about things going on in the hospital and how we're all coping with COVID-19.
Absolutely.
So, few housekeeping pieces. I'm just checking to be sure that our technology is working here. People should be able to ask questions via Facebook. I'll see them and ask them as time allows. If we don't have time to get to everything, assuming you'd be willing to come back, we'd love to have you back and answer those then. But we'll start in. First off, how are you, and how are you and your family coping with all things COVID-19?
All is good. All is good. Everyone so far has been healthy. No one's gotten sick, and obviously a little shut in and ready to go out and experience more of the regular world. But slowly dipping the toe out and doing a little bit more and more. But things are coming along. So, and hopefully people are seeing more and more of that. That more and more people are doing more.
Right. Well, I assume you've become an expert homeschooler, like most parents.
That is my wife. That is my wife. Yeah.
Well, you mentioned more people getting out and doing things. I think we kind of have two camps, right? There's some people who are taking advantage of maybe having a little more downtime and are getting out, exercising more. Conversely, you've got some people who aren't able to go to the gym like they have in the past and are maybe looking at new or different ways to exercise. As an orthopedic specialist, can you kind of talk through what are ways that people can protect themselves if they're maybe new to exercising or exercising in different ways? How can they minimize the risk of injury?
So usually if someone's been a little bit more sedentary and they're starting to do a little bit more, we definitely want to start off with something more low energy, walking, going around the block, going around the neighborhood, rather than starting on the running right away. We all think of our younger years and how we used to be much more in shape, and then we kind of lose that shape and get sometimes a more round shape. And so sometimes we got to start off with much more low energy kind of exercises with gentle motion and walking rather than getting more aggressive with running. And when my patients come in and I'm talking about rehabbing injuries and things like that, the things that we look at are trying to use, if someone's going to weightlifting, trying to use light weights and trying to do more repetitions, trying not to damage anything. Usually once we get out of our 20s and 30s, most people know we're not trying to get that beach body where we're just ripped with muscles. We're trying to stay toned and try to stay healthy and keep from getting an injury. So lightweight with lots of repetition rather than heavy weights with, just a couple of reps, because that is more likely to cause an injury, especially in someone that's just starting out on working out and getting active again after having been sedentary.
What about the risk of COVID-19 as people are maybe doing more exercising and getting out in public? Can you talk a little bit about what's safe to do and how can people minimize the risk there too?
Yeah, absolutely. So when we talk about activities, the thing, with COVID-19 is a respiratory droplet. And so everyone's, the concern is always being close to other people that may have it and maybe asymptomatic and not know that they have it and breathing in those droplets. Walking around the neighborhood, if it's a household member, probably not going to cause any sort of risk of, inhaling that droplet. The CDC just yesterday issued new guidelines stating that, the virus doesn't live on objects as long as we thought. They had thought it was 10, 14 days it could live, and now it's hours that they think it's living on objects. And so, we're finding different things as time goes on about this virus that once thought true may not quite be as true as we thought. And so when, starting up activities, obviously continuing to try to, social distance and be as safe as you can, but still getting out there. And, if you go to a park, most of the time we can distance significantly, not 6 feet, not even 12 feet. We can be 60 and 100 feet away from people and exercising, stretching, doing, walking. And, if we're at our home, lifting light weights and doing stuff like that and trying to stay active as we can.
What are some of the things people should look for as far as symptoms that they may have an injury that would require someone like yourself?
Yeah. So most of the time, especially with orthopedic injuries, and in general, people know this, but something that continues to linger. We all get aches and pains, and most of us know what to do with for those. And we talk about things like anti-inflammatory medications or pain relievers, and then obviously things like ice and heat and rest, and giving it a couple of days. Is it getting better? But if it's not getting better, if things are lingering and it's continuing to have more and more pain, then starting to consider, making an appointment to get checked out to make sure that it is normal, that it will continue to get better. Sometimes injuries do take months to get better, not just days or weeks. And so when things are continuing for long periods of time, that's when we really want to get people plugged in and figure out and make sure that what they're having is normal and that it will get better. Or, we can take a look at other options if something else is going on.
So could you talk a little bit more specifically about specific symptoms that people would necessitate calling an orthopedic surgeon? Are we talking hip pain that lingers, knee pain that lingers, things like that?
Yes. So, common stuff we see in our clinic is knees and shoulders. So, so shoulder pain in the front of the shoulder or back of the shoulder. One of the things that we know that people do when shoulders start to hurt is, they stop moving them because a lot of times that'll kind of settle the pain down a little bit, but that'll result in stiffness. And so then they get this stiff shoulder and it's not moving well. And sometimes that, creates its own conundrum of how to solve that. And so gentle motion for that shoulder issue is always important. But then also, yes, knee pain, especially pain in the front of your knee where, you've been doing different activities, whether that's kneeling or squatting. And then that can, kind of linger also. But people come in with all kinds of complaints. Tennis elbow is very common. And most patients that we see with tennis elbow, they ain't out there swinging a racket. They're doing normal day-to-day activities like me and you, Nick. And all of a sudden, next thing you know, their elbow is sore. They can't sleep at night. Everything they lift causes pain. The other complaints that you look for that people come in commonly, numbness in their hands, things like that, where people come in with carpal tunnel type symptoms. And then, other aches, like you talked about, hip pain. A lot of times hip pain doesn't mean it's an arthritic hip. It can just be a sore muscle around the hip or even a bursa that's sometimes sore and causing pain. And people come in commonly with ankle discomfort, whether it's an ankle sprain that's not getting better for some reason, or if they have, sometimes I'm sure people have heard of plantar fasciitis, where they get soreness on the bottom of their feet when they stand. And, all of these things can start to add up. And, one of the things we've noticed in the medical community for sure over the course of the last couple of months is people have kind of let things go for a while because they didn't want to go out. They don't want to go see their doctor. And, at first, I feel like that was fairly appropriate because everyone was a little scared about what was going on and what we were going to do as far as treating these things because people didn't want to go out and expose themselves to something they didn't know what was happening. But I think that over the course of the last few weeks, we've kind of seen that we know what our exposure risks are. We know what is safe and what is not safe. Our office has been open the whole time during this whole shelter in place order. And we're starting to see a definite uptick of more patients coming in, and we're trying to relieve their symptoms a whole lot.
Absolutely. Let's talk more about that. You make a great point that now that especially stay-at-home orders have been lifted, it's important that people are getting the care they need. Certainly when we're talking about needing an emergency room or management of chronic conditions, but it's safe now to come for any needed healthcare. Can you talk a little bit about what we've done in your practice specifically to protect both patients and the staff that work there?
Yeah. And the nice thing about being an orthopedic surgeon and orthopedic injuries is, I'm not treating chest pain and things that are dire emergencies, fortunately. And so for those patients, definitely get it checked out because in my clinic and at the hospital I work at, yeah, there's lots of, safeguards in place. We do an assessment, which I think more and more people are coming more familiar with. When you come in, there's a questionnaire. They ask you questions about recent travel, fevers, coughing, sneezing, things like that. And as long as all of that is negative, you get your temperature taken, then you come through to the clinic. We have kept our numbers in our lobby much lower because we want to make sure people are distanced, and we want people to know that they're safe. We don't want to have people, feeling like they're packed into an airplane, because no one wants that feeling right now. It raises a lot of anxiety, and that's what no one wants to feel.
It's not a feeling you want anytime. Certainly not now.
Yeah, exactly. No one wants that middle seat. But then bringing them back into the room, and then our office staff they all wear masks. Everyone's masked up. The other thing that we do as well is try to practice good hand hygiene, trying to make sure the patients are comfortable with everything that's going on. We offer telehealth also through our office, where if someone doesn't want to come in, we can do that. Sometimes with orthopedics, that can be difficult because we do a lot of physical exam. But sometimes we can hear a complaint and see where you're sore and talk to you about the injury that you've had and what you've tried, and sort it out and give you a diagnosis and a way to hopefully get it feeling better.
Right. Well, a lot of times with orthopedics, I've heard, and please confirm, a surgical intervention is often the last step. That there's a lot of things that you can try beforehand, and so that first step of telehealth might be appropriate.
Exactly, and you are exactly correct. We try anything we can to keep from doing surgery. I know sometimes patients get frustrated that we end up going to a surgical intervention, but it's always after trying something more conservative, whether it's injections, physical therapy, rest, things like that can help with a lot.
Well, let's segue over to talk about surgery. Recently, within the last couple of weeks, the Louisiana Department of Health has allowed hospitals to start with elective or scheduled surgeries again. Jumping over to some of the questions that have come in since we started talking. First, there's a comment that says Dr. Willie is the best, so I'll share. You are the best. But also, there's a question asking, is Lakeview doing COVID-19 testing prior to surgeries? Can you talk a little bit about what we're doing on the OR side to all keep patients and caregivers safe?
Yeah, so the thing that we're doing at Lakeview when people are having surgery is, so there's two reasons. Number one, every patient that's going to have surgery here is going to get a COVID test for the antigen to see if you're actively infected. And like everyone knows, that everyone is worried that you're an asymptomatic carrier, and that's what we don't want for our employees here. And the surgeon. So so we want to test you for that, to make sure that you're not exposing people and that you didn't know you were an asymptomatic carrier. And so you'll get tested before surgery, but also importantly is the peace of mind for the patient. If you're getting ready to have surgery, and if you're an asymptomatic carrier, and then suddenly, 3 or 4 days later, you start getting sick with a surgery that, was not, needed emergently. You weren't having chest pain, but, you were having some sort of, bad shoulder pain that hadn't gotten better with conservative treatment, and we're fixing your shoulder. We want you to know that also, to make sure we're not, proceeding with a surgery that, we could have waited another week or two if needed. Right. And then all of a sudden you're an asymptomatic carrier. So it gives the patients a peace of mind, but also everyone working with you. There is dozens of people that work with that patient on the day of surgery, from the pre-op nurses and the OR nurses and the, environmental services throughout the hospital, and, all of the other people that are coming through and helping that patient through that day. We want to make sure they all have peace of mind as well.
Right. And those precautions that you're talking about in the OR are in addition to things that are hospital-wide, like universal masking and visitor restrictions.
Exactly.
Visitors coming in, et cetera.
Yeah. And I know a lot of patients have been reluctant to even want to come to the ER for emergencies and problems like that, because they feel like, well, the hospital is where the COVID patients are going to be located, but they are, I don't want to say housed in a different area, but they're completely away from
unit. Yeah, right.
Yeah, they're in a special unit, and there's no contamination between the two. And yes, universal precautions are taken care of all through the hospital. And we want people to know it is completely safe to be out. And when my family asks about it, I tell them, I'm like, it's just as safe as going out and going to the store to get a gallon of milk. Is there a risk? There's a risk with anything we do now, but it's no higher than it is anywhere else.
Right. In fact, I was talking to a nurse recently who said she feels safer at work because she knows that everyone's been screened, everyone's wearing a mask.
Yes,
and you don't have that. And I guess unless you're at Costco, you don't have that everywhere. So.
That's very true.
Well, thank you for your time today. Is there anything else that you'd like to tell the community? Any other questions that you're getting in your office that you think would be helpful to share?
No, I've done more than anything. I would tell people, obviously to be careful. I was talking to a surgeon recently, and he was saying, yeah, with the change in our activities recently, because we've all been shut in, and so some of us have become new carpenters because we wanted to build something, or become a little bit more like we talked about moments ago, becoming a little bit more active. Just to be careful, because all of a sudden that power saw that you never used before now becomes a dangerous weapon, and we don't want people losing fingers. We want people to be smart with what they're doing, because we don't need to drum up business. We are happy with what we got, and we don't need other kinds of emergencies like that happening. So be careful and be smart about what you're doing.
That is great advice. Thank you again for your time. Dr. Worley is a orthopedic specialist with Lakeview Regional Physician Group. You can schedule an appointment with him or some of our other wonderful doctors at lakeviewregional.com. We also have some information on that website about what we're doing to protect you and our staff against COVID-19. And there's some great reading there if you have questions. But with that, I think we'll sign off. Again, thank you very much, and we'd love to do this again with you sometime.
Thank you, Nick. Absolutely. Anytime, man. I appreciate it.
Likewise.
Thanks.